Okay, so we've been talking about the thyroid gland, and in the previous video, we have seen the location, the extent, and the relations of the thyroid gland. In this video, we are going to see the arterial supply, venous drainage, the lymphatic drainage, and the nerve supply of the thyroid gland. What I've done is I've summarized the lecture in this slide. However, let's start by talking about the arterial supply before we come back to this. So in the arterial supply of the thyroid gland, you have to remember that the thyroid gland is a highly vascularized structure, okay, and it's supplied mainly by three sets of arteries, which are the superior thyroid, the inferior thyroid, and the thyroid-ema artery. Okay, now these vessels lie between the fibrous capsule and the loose fascial sheath. So it's a fibrous capsule of the gland and the pretracheal fascia. Now, coming to the first branch, okay, let's start by talking about the superior thyroid artery. Now, the superior thyroid artery is the first branch of the external carotid artery. This is the superior thyroid artery, and it's the first branch of the external carotid artery, and it descends to the superior poles of the gland, pierce the pretracheal fascia, and divide into anterior and posterior branches, supplying mainly the anterosuperior aspect of the gland. Now, the idea is quite simple, okay? The anterosuperior aspect, it's supplied by the superior thyroid artery, the superior thyroid artery being a branch of the external carotid artery. Also, at the level of isthmus, the right and the left superior thyroid arteries anastomose. Okay, but if you want to know the detail of the branch from where the superior thyroid artery is arising, let me show you this diagram, right? So there's basically a difference from the way the right superior thyroid artery is arising and the left superior thyroid artery is arising. Now, both of them are branches of the external carotid, and the external carotid is in turn a branch of the common carotid. The only difference lies in the fact that the right common carotid artery is a branch of the brachiocephalic artery, okay, and the left common carotid artery is a direct branch of the arch of aorta. So it's quite simple, right? The left common carotid is a branch of the arch of aorta, and the right common carotid is a branch of the brachiocephalic artery. Further, they both give rise to the external carotid artery, whose first branch at the level of the greater cornu of the hyoid bone is the superior thyroid artery. Okay, now in this diagram, you can also see one important point, which is its relation to the external laryngeal nerve. Okay, now I'll come back to this after we talk about the inferior thyroid artery and the thyroid-ema artery. So let's go to the inferior thyroid artery. Now coming to the inferior thyroid artery, these are branches of the thyrocervical trunk arising from the subclavian arteries. Okay, they run superomedially posterior to the carotid sheaths to reach the superior aspect of the gland and supply the postero-inferior aspect, including the inferior poles of the gland. Okay, so again the same idea follows. Both the inferior thyroid arteries arise from the thyrocervical branches of the subclavian artery. The only difference being that the right subclavian is a branch of the brachiocephalic artery and the left subclavian is a direct branch of the arch of aorta. So now we see that they are both branches of the thyrocervical trunk and they run superomedially posterior to the carotid sheath to reach the superior aspect of the gland. Now in the beginning I told you that the thyroid gland is a highly vascularized structure and it is called rich anastomosis, right? So we see that the right and left superior and inferior thyroid arteries form anastomosis within the gland. Okay, so all of these form anastomosis within the gland. And you can also see that at the level of isthmus, we see the right and left superior thyroid arteries anastomosing. Now at the lower level of the isthmus, we see the thyroid-ema artery, which is our third artery. So in about 10% of the people, there's also a small unpaired thyroid-ema artery, which is a branch of the brachiocephalic trunk. It ascends on the anterior surface of the trachea and continues to the thyroid isthmus. The isthmus which joins two lobes, right? The clinical anatomy relevant to this is that the presence of this thyroid artery must be considered before tracheotomy because it can be a potential source of bleeding. Okay, so with this we actually finish the arterial supply of the thyroid gland. Now let's go to the clinical anatomy relevant to the nerves associated. Okay, so in the superior thyroid artery, we see that as it is branched off from the external carotid artery, at its origin, it's closely related to the external laryngeal nerve, which is this nerve. It's a branch of the superior laryngeal nerve from vagus. So at its origin, they're closely related, but as they approach the upper pole of the gland, they move away. Right? The nerve moves away from the artery. So in order to avoid injury to the external laryngeal nerve, the superior thyroid artery has to be ligated just near the superior pole of the thyroid gland. Okay? And in case of damage to the external laryngeal nerve, we would see changes in the pitch of voice and inability to make explosive sounds due to the paralysis of the cricothyroid muscle. Okay, so the basic idea here is to ligate it as close as possible to the pole. Now when we come to the inferior thyroid artery, let's see what happens. So the inferior thyroid artery, we see that the recurrent laryngeal nerve, which is also a branch of the vagus nerve, lies close to it near the base of the gland. Okay, so it's quite the opposite. Near the base of the gland, the recurrent laryngeal and the inferior thyroid artery are closely related. Hence, the inferior thyroid artery has to be ligated as away from the gland as possible to avoid damage to the recurrent laryngeal. So that's it in the arterial supply of the gland. You've seen it's supplied by the superior thyroid, branch of the external carotid, inferior thyroid, branch of the thyrocervical trunk, and thyroid ema, which is a branch of the brachiocephalic artery. Now let's go on to the venous drainage. Now the venous drainage is also quite similar to the arterial supply. It's supplied by three pairs of thyroid veins, which are the superior, middle, and inferior. These form the thyroid plexus of veins on the anterior surface of the gland, anterior to the trachea. So you can see here, there are three pairs of veins, which are the superior, middle, and the inferior. Now, as you can see, the superior thyroid vein emerges from the apex of each lateral lobe and accompany the superior thyroid vein. The middle thyroid vein emerges from the lower part of the lobe and run almost parallel to the inferior thyroid artery. The inferior thyroid vein accompany the thyroid ema artery if present, right? We saw that the thyroid ema was going from below to the isthmus. Now the inferior thyroid is going away from the isthmus towards the brachiocephalic vein. So now that we have seen that it's supplied by, it's drained by the superior thyroid vein, the middle thyroid vein, and the inferior thyroid vein, we see that also occasionally it's supplied by the fourth Kocher's vein, which emerges between the middle and the inferior thyroid vein to drain into the internal jugular. Okay, so the idea is that the superior thyroid vein and the middle thyroid vein drain into the internal jugular vein, and the inferior thyroid vein drains into the brachiocephalic veins posterior to the manubrium sterni. Okay, so three veins, the superior and the middle drain into the internal jugular, and the inferior drains into the brachiocephalic vein. Now let's go to the nerve supply. Now we've already seen in the arterial supply that the superior thyroid was related to the external laryngeal nerve and the inferior thyroid artery was related to the recurrent laryngeal nerve. So we see in the nerve supply it's quite easy to remember that the parasympathetic nerve supply is related to the superior laryngeal nerve and the recurrent laryngeal nerve, both branches of vagus, and the sympathetic nerve supply is from the cervical sympathetic ganglion, mainly from the middle cervical sympathetic ganglion. Finally, wrapping up with the lymphatic drainage. The lymphatic drainage of the thyroid gland is also quite extensive and flows in a multidirectional pattern, ultimately draining into the internal jugular vein and sometimes the brachiocephalic lymphatic nodes or the thoracic duct. So the idea is that there are lymph nodes at the primary level and the secondary level, right? So at the primary level, we have the prelaryngeal nodes, pretracheal nodes, and the paratracheal nodes. And at the secondary level, we have the superior deep cervical nodes and the inferior deep cervical nodes. Now the prelaryngeal nodes drain into the upper deep cervical nodes, and the pretracheal and paratracheal drain into the lower deep cervical. Now in this slide, I have summarized the lymphatic drainage as well, right? So the prelaryngeal lymph nodes lie in front of the cricothyroid membrane and drain into the upper deep cervical. The pretracheal lie in front of the trachea, and the paratracheal lie alongside the trachea and drain into the lower deep cervical along the internal jugular vein. Finally, let's just conclude the lecture by summarizing about the arterial supply, which was by 3 sets of arteries, the venous drainage again by 3 sets of veins forming the venous plexus, the lymphatic drainage, which was at the primary and the secondary level, and the nerve supply, which was through the sympathetic and the parasympathetic sources. So that's it in the discussion of thyroid gland. It was quite detailed, and I hope you guys got some help out of it and you enjoyed it. Thank you so much for watching, and stay tuned for more.